Good afternoon, everyone. Today, I'm here with Dr. Vijay Agarwal. He is a consultant medical oncologist here in Apollo Hospital, Bengaluru. And today, we are going to have a little chat about kidney cancer. So, firstly, I would like to ask you, what exactly is kidney cancer?
Kidney cancers are basically any cancers that arise in the kidney. Now, kidney is an important organ in the body. We have two kidneys, one on the left and one on the right. And the main role for the kidney is to form urine and excrete urine, through which they excrete the toxins. When there's cancer that develop in the kidney, they're called kidney cancers. And there are different types of kidney cancers that exist. The commonest ones are what we call as a clear cell kidney cancer. Then there are other types of cancers such as non-clear cell kidney cancers, a transitional cell carcinoma of the kidney, or Wilms tumor, but they tend to be more rarer forms of kidney cancer. But when we talk about kidney cancer in a colloquial term, what we mean is a clear cell carcinoma of the kidney.
Okay, and what exactly is the diagnosis for kidney cancer?
In terms of diagnosis, I think most people they tend to present with some symptoms to the doctors, and the common symptoms that kind of arises are pain in the kidney area or back pain. They can sometimes have bleeding in the urine, and sometimes they can also have weight loss, general tiredness and fatigue. These tend to be the commonest symptoms that they present with. When they do present with these symptoms, we then tend to examine them, have a more detailed evaluation. Sometimes we can feel the lump in the kidney when we're examining the patients, but more often than not, we need to do certain investigations. The commonest investigations that we tend to do are ultrasound of the kidneys. We also tend to do a CT scan or a PET CT scan to kind of further evaluate whether those kidney masses may have spread to other organs in the body. In terms of diagnosing the cancer itself and to deciding what type of kidney cancer it may be, we tend to do what we call as a needle biopsy, where we put a needle into the kidney area to take a piece of the tissue and send to the lab for evaluation. So these are the commonest investigations that we do to identify the presence of kidney cancer, what type of kidney cancer it is, and what is the stage of kidney cancer. And what I mean by that is where if it's spread to any other organs in the body.
As you're saying that kidney cancer can spread to other organs of your body, can a kidney cancer convert into other types of cancer as it is spreading to other parts of the body?
So when a cancer spreads from one organ to another, it's so for example, when you have a kidney cancer and that tends to commonly spread to the lungs, it does not become a lung cancer. It still remains a kidney cancer that has spread to the lung, which is different from a cancer arising in the lung, which is what we call as lung cancer. So we still treat them completely differently. So when you have a cancer that has gone from kidney to the lungs, it does not become lung cancer. It still remains kidney cancers that has metastasized to the lung. So the treatment protocols depend upon the kidney cancer treatment protocol and not the lung cancer treatment protocol. So the nature of the cancer does not change. It is only the cancer that spreads from one organ to the other.
Okay, so it's like a virus or a microorganism basically, which is spreading to your body, but it cannot be converted into something else.
That would be a reasonable analogy to have, yes.
Okay, and how rare is kidney cancer?
So kidney cancer is not very, very common. The commonest cancers that we see in our clinic are mouth cancers, lung cancers, breast cancers, colon cancers, and so forth. So it's a reasonably rare form of cancer. Nevertheless, I think a lot of people do develop kidney cancers, particularly if they have a strong family history, and that is something that we have to keep in mind, that if there's a strong family history of kidney cancers, then I think they should be getting themselves tested more often.
Okay, so basically the chances of you having kidney cancer is completely based on your genetics, like 90%?
No, not particularly. I think only about 15 to 20% of the cancers that we see in our clinic are genetically linked. But most of the time, the exact causality of kidney cancer is not known. Genetic risk is just one of those risks that exists. But in most of the times, we're not able to evaluate what's caused the kidney cancer.
Okay, so there's no proper, way to know why someone has kidney cancer. Okay, and another question that I have is, what are the treatments and the different types of treatments of kidney cancer?
So the treatment of kidney cancer depends upon the stage of the cancer. So there are 4 stages in cancer: stage 1, 2, 3, and 4. By and large, when you have stage 1, 2, and 3, the treatment intent is to try to cure. Stage 4, the chances of cure is very, very less. Try to look at quality of life and longevity of life rather than the cure itself. The in stages 1, 2, and 3, the surgery forms the mainstay of treatment. So removing the mass along with the kidney, either we remove half the kidney or the full kidney depending upon the size of the tumor and the location of the tumor. But by and large, surgery forms the mainstay of treatment in early stages of kidney cancer. In advanced stages, when I say advanced, I'm talking about stage 4 cancers. The main treatment modalities are immunotherapy and targeted therapy, either alone or in combination. Chemotherapy tends not to work very well in the typical clear cell kidney cancers, so we don't use chemotherapy that frequently in this group of patients. It is more immunotherapy and targeted therapy or combination of the two. Nowadays, we've even started using immunotherapy in stage 3 kidney cancers after surgery to reduce the risk of recurrence, and that has shown significant amount of benefit, and that is something we do as well.
Once the kidney cancer is cured, what are the chances of recurrence?
So again, that would depend upon the stage of the kidney cancer. I think in terms of early stages, particularly stage 1 and 2, the chance of recurrence is very, very less. But the chances are quite high in stage 3 kidney cancers. So we have to follow them up for about 5 years at the very least. The chances of the kidney cancer recurring after 5 years is quite small. Okay, but the risk of recurrence is higher with higher the stage of the cancer. But generally, if it's stage 1 cancers, we don't worry so much about it because the risk of recurrence is very, very small.
And what are the lifestyle changes that a person could make, or what can a person generally do to avoid kidney cancer?
So there's no direct causality of kidney cancers, but nevertheless, I think with all cancers, I think people need to lead a healthy lifestyle. So avoid smoking, exercise regularly, say no to alcohol, maintain your body weight within permissible limits, and exercise at least 3 to 4 times a day. So these tend to reduce the risk of cancer overall. There's no direct causality of any of this with kidney cancer per se, but nevertheless, I think leading a healthy lifestyle will reduce the risk of cancer overall.
Okay, thank you very much, Dr. Vijay Agarwal. This was a very interesting session about kidney cancer. Okay, I think what we mainly have learned is that if you have a hereditary factor in your kidney cancer, you should definitely get checked. And I guess we don't know what causes this, so if anything happens, you should just go to your doctor and get yourself diagnosed at the earliest stages.
So I think what happens is that because the tumors can grow to a reasonable size before they become symptomatic, a lot of these patients are asymptomatic, and a lot of these people just have some dull ache and pain and may have had bleeding in the urine once or twice, and they tend to ignore it, that it will go away, or it might just be an infection, and kind of they just pull along for a few more months. And I think that's the important message, that if somebody has any symptoms that may suggest kidney cancer, either pain in the back or pain in the kidney area or bleeding in the urine, I think they should seek medical help sooner rather than later. And I think that's the message that we want to get across, particularly on this kidney cancer day, that early intervention, early help will improve outcomes overall.
Yes, of course. And I also do believe that people who are asymptomatic as well, I think all people in general should do a health checkup pretty much every year. I think that could be the best way to prevent it.
So we have a master health checkup program here at Apollo, which people can avail, and part of the package involves doing an ultrasound of the tummy that does commonly pick up these tumors, that commonly picks up these tumors. So I think master health checkup helps not just for cancer itself, but for all diseases, particularly your lifestyle diseases such as diabetes, hypertension, heart risks, and all of those things. So I think it's always a good idea to get a master health checkup done once in a while.
Okay, and I think Apollo Hospital would be great for that, as you have a program for all these things.
So we have a very well-run pro health program which is designed for people who are currently not well. It is more of a preventative strategy, where people are given a more detailed evaluation and advice on health and exercise and diet and things like that.
Okay. Once again, thank you very much for this very informative session, Dr. Vijay Agarwal. It was I had a lovely time talking to you.
Thank you very much.
You're welcome.